It surprises most people to know that half of the children in the United States get their coverage through Medicaid and CHIP. And that is a higher number for families of color. Children of color are covered at disproportionate rates. And right now we find ourselves in this historic moment where during the pandemic, states got extra money from the federal government to support their budgets, to support their Medicaid programs, because whenever we have a crisis, our country turns to Medicaid. And that was true again. And we had an economic crisis and we had a health crisis. So Congress said, we're giving you extra money. You can't cut back coverage, right? They always say that when they give extra money for Medicaid. When unemployment goes up, there's more pressure on Medicaid. But we also had a pandemic and something we hadn't experienced before. So Congress said, you can't cut anybody off Medicaid who wants to keep their coverage. So that brought us to a point where 90 million people were covered by the Medicaid program, about 1 in 5, 1 in 4 in the country. And now states are going through the process after the public health emergency was lifted of checking everybody's coverage. So this is a huge, huge job. And unfortunately, our states don't have, in many cases, the best systems to handle this kind of workload, particularly states that are not politically invested in keeping families on coverage. We're seeing high rates of termination.